Hi everyone. So today I've come up with something which will tell us how we can prevent tooth decay or cavities, which is the second most common disease affecting the children specifically. So to understand what prevents tooth decay, we need to understand what causes tooth decay. And if you might have seen my previous video, it was all about the causes of tooth decay. I shall link that in the description box too, so you can check that out. So the first thing is bacteria. The first causative agent is the bacteria. And how we can prevent tooth decay is by not letting the bacteria do its job. So the first thing is brushing. Of course, you might have heard that to prevent tooth decay, you need to brush twice and floss daily. So what brushing does is it removes that micro layer of microorganisms or the bacteria that is attached onto the tooth surface. Brushing, regular brushing in fact, that is twice in a day, it disrupts or it removes that layer of bacteria that is very firmly attached to the tooth surface. Number one. Second is flossing. Flossing is supposed to be done every day before sleeping, after you've had your last meal or after your child has had his or her last meal. What flossing does is flossing reaches those areas of tooth which are not possible to be reached by brushing. And third is rinsing. Rinsing basically removes the food particle from your mouth. So if it's removing the food particle, obviously it's snatching away the food of the bacteria also, because it's the bacteria that works on the food that you take and produce acid, which in turn causes tooth decay. I hope it all makes sense. If you see my previous video, it'll all make sense if you see both the videos in continuation. So brushing, flossing and rinsing specifically target bacteria, and it removes the bacteria from the tooth structure. The second is the saliva. As I told you, saliva has got a very important role in not just providing the necessary minerals in the mouth and the tooth structure, but it also has a very active role in cleansing your mouth. The more you have your saliva, the more is the cleansing or the rinsing action. And to have more saliva, you're supposed to be drinking more water. So drinking more water is very important. And the general rule of thumb is you're supposed to take almost zero point 0.5 to 1 ounce of water every kg of your weight. And the third way of preventing tooth decay is having a proper diet. And by proper diet, I mean you're not supposed to take, or you're supposed to minimize the utilization of refined carbohydrate. Now, refined carbohydrate includes everything which you can see on the screen and many more. Not just confined to this. You're supposed to reduce your cupcakes, your cakes, your breads, your biscuit, soft drinks, carbonated soft drinks, or sugarated drinks, those juices that you get in Tetra packs, French fries, and coffees, those coffees with heavy sugar. So these are all the things, those chips, these are all the things which are refined carbohydrate. Now what refined carbohydrate does is it has got a tendency of sticking to the tooth structure, and it's very difficult to remove. You might feel that you've rinsed enough and everything has come off your teeth, but that's not the truth. What it causes is it is in those pits of your tooth, it is there somewhere, and if it's there obviously for a longer period of time in your mouth, the bacteria has got its thing to work on it and release acid. So that is to be avoided. The more you can, the better it is for you. Second is you're supposed to reduce your frequent munching. That means you're supposed to have a gap of at least 2 hours in between your meals. I keep repeating this to all my patients. They don't understand just having a biscuit here and there. So often you might not have the entire packet. You've had one slice of bread, let's say. Another 40 minutes or so, you've had one small bite of anything. It can be as healthy as an apple also. So that is to be avoided. Whatever you take, you see that you have a gap of minimum 2 hours, because frequent meal munching, um, uh, it causes regular acid release, and that regular acid release keeps the environment of your mouth acidic always, and that makes the environment even more easy for the tooth decay to happen. So these are the things you're not supposed to take, and these are the things which you're supposed to add in your diet. That means you're supposed to take a lot of fresh vegetables and fruits. Vegetables and fruits are important because when you're munching on those fruits, the skin of those fruits and otherwise also the texture of those fruits are such that it rubs the tooth surface and cleanses the uh, the thin or the microfilm of bacteria that is there on the tooth. It cleanses that away. Second thing is, you're supposed to add, obviously within limits, but you're supposed to add cheese and butter to your diet, because that provides a protective coating on the tooth surface and does not let the bacteria to be that easily attached to the tooth surface. So that's also very important. And you're supposed to take as much as possible those coarse carbohydrate. Take whole wheat grain breads, whole wheat atta for your chapatis. You're supposed to substitute your snacks with healthy snacks like makanas, that is foxnut that we say. Take popcorns instead of taking cookies. So you're supposed to make a healthy alternative to your snack section also. Then, yes, this is also there, that you're supposed to get your faulty tooth surface corrected. I keep on talking about this because no matter how hard you work on your brushing and your diet, there's no point if you have by birth or from the time the tooth has erupted, it has got those abnormal shapes because of which it's easy for the bacteria to hide in there. Then there's no point in taking all these meticulous steps. So you're always supposed to get these are just examples. You can have defects more than these also, or something different from this also. So you're supposed to get that corrected. Then uh, you have regular dental checkup, and I cannot stress enough on how important it is. Yes, it's very important for your child to visit their dentist for at least 3 months. If not 3 months, get them checked at least once in a year. That's the least one can do. Otherwise, ideally one should get checked every 3 months. What regular dental checkup will do, you might not identify an ongoing tooth decay process, but a doctor, a dentist will. So, if you're having a regular visit to the dentist, it will help in early identification of the decay process and will obviously tell you ways of how you can prevent it, and then you can work on it even more vigorously and not let the decay process overtake you. So that's it. I hope I was clear enough, I was precise and quick enough for you to understand and follow these steps and save yourself from cavity. That's it for now. Take care.